For many young people, nightclubs allow you to feel free and lose your inhibitions. Some even go as far as casual hookups. This seems like a typical Friday night for many people. But how many of those people are thinking about the potential sexually transmitted diseases they could get? Any STD is bad news, but one of the worst ones is HIV. Human immunodeficiency virus is incurable, and it causes the immune system to weaken by killing CD4 T cells, which is a type of white blood cell. White blood cells help keep us from getting sick. If left untreated, HIV progresses and the body has fewer and fewer T cells to fight off infections. When the number of T cells gets very low, the person is declared to have AIDS, or acquired immunodeficiency syndrome. A person with AIDS is very susceptible to everyday infections because of their lack of white blood cells, so something as simple as the flu could kill a person with AIDS. Because HIV is spread through the transmission of all these bodily fluids, it is important for all sexually active people to know they are at risk for getting it. Aside from abstaining from sex, the best way to protect yourself from catching the virus is to use condoms during vaginal, anal, and oral sex. There are other ways of contracting HIV though, such as using contaminated needles when injecting street drugs. It can also be passed from mothers through pregnancy or breastfeeding, and potentially from getting blood transfusions in other countries. So what should you do if you think you may have been exposed? Get tested. The CDC recommends all people between the ages of 13 and 64 get tested at least once, and individuals more at risk should be tested annually. Groups of people who may have a higher risk of catching HIV are men who have sex with men, transgender people who have sex with men, people with more than one sexual partner, people who have recently had a sexually transmitted infection, people who use injection drugs, and you should also be tested if you are pregnant or plan on becoming pregnant soon, and if you have ever been in prison. Typically, your blood or saliva will be tested, and it may take several weeks to receive your results. You can find local and discreet testing centers near you through https://aidsview.org/services. If you find yourself to be at a higher risk for catching HIV, there is medicine that provides more protection than just using condoms. PrEP is a daily pill that is also known as pre-exposure prophylaxis. It is for people who are exposed to HIV often, like people in a relationship with someone who has HIV, or someone who regularly has unprotected sex. If you are interested in PrEP, you should talk to your primary doctor or gynecologist. Knowing is half the battle. So by learning that HIV spreads through bodily fluids and the best ways to protect yourself are through condoms and avoiding risky behaviors, you've already won. So the next time you or your friends go out looking for a good time, don't forget to use protection. And be sure to spread this message to further prevent the transmission of HIV for all.